Hello, this is Lawrence Eichenfield, Chief of Pediatric and Adolescent Dermatology at Rady Children's Hospital and Professor of Dermatology and Pediatrics at the University of California, San Diego. I'll be discussing topical tofacitinib for atopic dermatitis, a phase 2A randomized trial by Dr. Robert Bissonnette and colleagues. The study results appeared in the November 2016 issue of the British Journal of Dermatology. In summary, the results of this phase 2A study showed that treatment with the Janus kinase JAK inhibitor tofacitinib resulted in significantly greater efficacy versus the vehicle, with early onset of effect and comparable safety and local tolerability in vehicle. I think that the importance of this study is that despite our present armamentarium of therapy, it's been basically almost 15 years until recently in terms of approval of a new topical therapy. And we would be excited to have another therapy with a new mechanism of action for atopic dermatitis. This study indicates that topical administration of a Janus kinase inhibitor is potentially a promising therapeutic option for patients with atopic dermatitis. The methods of the study. This was a 4-week phase 2A randomized, double-blind, vehicle-controlled parallel group study involving 69 adults with mild to moderate atopic dermatitis. Patients were randomized 1-to-1 to 2% tofacitinib or vehicle ointment twice daily. And the application was a daily target rate of about 3 milligrams per square centimeter. Patients were instructed to continue the treatment of all treatment eligible areas that were delineated on day 1, regardless of whether they cleared or improved. And the primary endpoint for the study was the percent change from baseline in the eczema area and severity index, the so-called EASI score, at week 4 of treatment. And there were secondary endpoints that were included, including safety and local tolerability being assessed. The key findings of the study. So 69 patients were randomized, with 65 completing the study. There were 2 withdrawals due to an adverse event. The mean percentage change from baseline to week 4 in the EASI score was 81.7% for tofacitinib, compared to 29.9% for vehicle. So an impressive decrease in the objective eczema area and severity index. The patients treated with tofacitinib experienced a more rapid response based upon the EASI, the physician's global assessment, and change from baseline in the total body surface area, with significantly greater improvement in the tofacitinib group, improving at week 1. The pruritus was improved as well by day 2 in the tofacitinib group. And at week 4, the proportion of patients with a physician global assessment of clear or almost clear for tofacitinib was 73% as compared to 22% with the vehicle. Safety and tolerability were generally similar for both treatments. More adverse events were observed with the vehicle than for tofacitinib, although mild to moderate infection occurred in 6 tofacitinib and 3 vehicle patients. So here are my thoughts and analysis of this study. First, highlighting the main points of the study. Number 1, this is an intriguing study for many reasons. First of all, it's the first paper on JAK inhibitor, which is a pathway of inflammation that may be quite important in inflammation of atopic dermatitis. Second, tofacitinib is a novel topical agent and showed very positive results using standard objective methods in a blinded fashion from a well-respected research center. And third, an important aspect was the display that pruritus was decreased and that this occurred rapidly. I think this study may impact current management, but in the future, because what it shows now is that it shows the potential promise of JAK inhibitors for atopic dermatitis therapy. Now, an insight into this paper, unfortunately, the company that produces tofacitinib decided to drop the topical tofacitinib program. At the time that this study was being done, The drug was being approved orally, or it was under evaluation for systemic use. So systemic tofacitinib, which has been approved for rheumatoid arthritis, was being developed for cutaneous plaque psoriasis. But the approval got held up during development, perhaps due to the need to monitor for lymphopenia, anemia, neutropenia, changes in lipids or liver function when patients are using it systemically. However, the promise of oral and topical JAK inhibitors is still tremendous, even though it appears that tofacitinib won't be developed in topical formulation for atopic dermatitis. I think that this paper whets our appetite for further studies on JAK inhibitors for atopic dermatitis. You should be aware that some of the JAK inhibitors are already being used off-label for other inflammatory diseases, and may be developed for this as well in the future. That includes alopecia areata, as well as vitiligo. So there are some unanswered questions. Number one, can we get more topical studies with JAK inhibitors? We hope so. Can the promise of topicals with low systemic absorption bypass some of the issues with systemic JAK administration? Also, there's different pathways of JAKs that are present in the biology of humans. And so one of the questions we have is which of the JAK pathways will work out to have the best efficacy and safety ratios for atopic dermatitis. So much to figure out in the next few years, but a very, very intriguing paper.